Hello, everyone, and thanks so much for joining us for a special Ask the Experts Facebook Live Q&A hosted by Moffitt's Patient and Family Advisory Council. We're excited to have you here today, and we're going to have a great panel of experts available who will answer your questions about the COVID-19 vaccine and the boosters that are now available for cancer patients. Joining me are Dr. Robert Keenan, Moffitt's Chief Medical Officer, Dr. John Green, Chair of the Infectious Diseases Department. We also have Shani Parkin, who is a patient advisor and co-chair of Moffitt's Patient and Family Advisory Council, as well as David Dahman, who is a patient advisor. Thank you all so much for being here. Certainly appreciate that, as do our viewers, I'm sure. But before we get started, just a few quick reminders for our audience. Please submit your questions in the comments section below the video, and we'll do our best to get as many of those as possible today. But also, please keep in mind that we cannot offer personal medical advice or make any kind of diagnoses over Facebook. Additionally, remember, Facebook is a public forum, and any comments or questions asked here are visible to the public. But before we get into those questions, I'd like to hand it over to Shani Parkin, co-chair of Moffitt's Patient and Family Advisory Council, or PFAC, to say a few words. Shani, welcome.
Thank you so much, Steve, and welcome everyone. We're so excited to have you join us today. Just really wanted to give you a little bit of insight into what a Patient and Family Advisory Council is. The role of PFAC, as it is known, is to be the voice of both the patients and their caregivers. We partner with the Moffitt leadership team to share patients and caregivers' questions, their concerns, and their ideas to enhance the patient and family experience. Moffitt is committed to patient and family-centered care and its key concepts, one of which is sharing information. We think it's vitally important to share information that is useful and easy to understand to enable patients to make decisions about their care. And today we'd like to share information with our patients and the viewers today about the COVID-19 booster.
Thank you so much, Shani, for sharing that, and thank you to you and your team for hosting this Facebook Live. Again, before we get started, I want to remind folks who are watching us online that you're more than welcome to submit those questions to us in the comment section here, and we'll be answering those as quickly as we can with our team of experts here. So to kind of kick us off, I wanted to ask a question to you, Dr. Green, specifically. I've heard in different news outlets reference to a booster and also a third dose. And I was wondering, is there a difference in those two terms? And if there is, what is that difference?
Yes, so for example, a third dose would be for a leukemia or transplant patient who's immune suppressed. And we know that their immune system is about half of what a non-immune suppressed person's will be. And therefore, they need to have a third dose to get them to the level as high as possible for protection. And that is given 1 month after the second dose. A booster, on the other hand, is more, for example, me, who has a normal immune system. And I have waning or dropping immune system after my vaccination 9 months ago. So they set the parameters. If it's 6 months after your second dose and you qualify, such as myself, then I should get a booster to get my antibody level up and give me added protection 6 months after the last the second dose. So therefore, there's some fine nuances between the terminology, a third dose, as I mentioned, and a booster, but they both do the same thing, which is they make our immune system higher, but the timing and the population who should get it is a little different. So I hope that makes sense.
It does. And a follow-up question for you there too. Are the doses the same amount of I guess, of the vaccine going in, whether it's a booster or a third shot, or do we know that answer yet?
Yes, so the same dose of Pfizer that you got in the first and second dose would be the same as in the third dose. Moderna for immune suppressed has been, in my understanding, is the same dose, but I just heard in a news flash from CDC head that they're considering the Moderna vaccine booster when it comes out officially in a wider audience is going to be half the dose as the first two, and that remains to be seen. And then the J&J vaccine, again, one dose covers it, and they're going to have data in the next several weeks on getting a booster if you got J&J. And I know this gets into a future question, but in the United States, we don't like mixing vaccines. So if you got Pfizer, we don't want to give you Moderna and vice versa, or J&J. We like to stay with the one you received. In Europe and other countries, they're more open to mixing and matching. It probably won't hurt you if that happened to you, but we don't have any data on the efficacy of how well that'll work.
And I'm glad you asked that, because or answered that. That was one of my questions as well. So here, at least in the States, we don't want to mix the brands. And you answered one of our questions from Deborah, who asked if the Moderna booster available. And it sounds like it's not available yet, but it should be coming soon. Dr. Keenan, I wanted to ask you a question. Can you kind of share with us who is eligible for the booster? Because I know it's very specific at this point. Could you tell us a little bit about that?
Sure. Thanks, Steve. And as Dr. Green pointed out, if you are immunocompromised, and let's just make sure we make that part clear. If you're immunocompromised and were approved to get that third dose a month or so ago, it could be either the Pfizer or the Moderna, depending on what you originally got. So to Dr. Green's point, we don't want you to mix, but both of those are available for those immunocompromised patients who meet the criteria for a third dose. So now putting that aside and talking about the boosters. So as Dr. Green says, for those people who are not in those severely immunocompromised categories, the FDA and the CDC, as people are probably aware, did approve Pfizer to be able to give a booster shot to certain populations. And so those populations are anyone over 65, anyone between 50 and 64 with an underlying medical condition. And there's a variety of things that go into that. So patients with emphysema, patients with kidney disease, patients who have cancer but are not considered to be severely immunocompromised. And there's a variety of conditions in that category. Going younger, anyone who's 18 to 50 or 18 to 49, with those same kind of underlying medical conditions, you can make a decision as to whether you want to get it or not. So they're recommending it if you're 50 to 64, if you have those conditions, but they're saying it's really more of a personal choice if you're 18 to 49. Although I think most of us would say, go ahead and get it. And then, of course, there are that category of frontline workers, which include the healthcare workers and teachers and first responders and others who 18 and above are able to get that booster without the need for them to be in any of those other categories. Just their occupation puts them at high risk so they can get a booster.
Of course, and you made some very good points, frontline workers, things like that. And this is a good question from Christine and Tula. Will caregivers be able to receive the booster, and can they receive the booster at Moffitt? Is that something we would be able to offer at some point?
So we would love to be able to offer it at some point. There was a conversation about that point when the advisory committee for the CDC was deliberating, and they really didn't come down on a solid recommendation in that regard. And so it was more about the institutional setting in which that puts you at risk, as opposed to being a caregiver for an otherwise eligible patient. So at this point, it's not entirely clear that you would be eligible, but as it becomes more clear, we will absolutely offer it.
That's good to hear, and thank you for sharing that, Dr. Keenan. I certainly appreciate that. Now, we do have some great questions coming in, and if you are just joining us, we do have our experts here answering your questions about the COVID-19 vaccine and boosters for cancer patients. So remember to put those questions into the chat below the video, and we'll get to those as soon as we can. Now, Linda has a great question, especially since it's the time of year where everybody's preparing for the flu season. How soon after the seasonal over 65 flu vaccine can you get the booster? What is the recommendation there? And I don't know if that's Dr. Green, if that goes to you, if that would be Dr. Keenan. I'm not sure who would have the answer to that.
Probably we both could answer. So Bob, would you like to?
I'm happy to. You're the infectious disease expert though, so
all right, I'll go
defer
for
to
it.
you.
Yes, so you could get the flu vaccine and the COVID vaccine at the same time. There's not a problem with that. If you're up for getting shingles vaccines and other vaccines like the pneumococcal vaccine, you can get the flu shot the same day. There's no problem getting 2 vaccines at the same time. And the flu vaccine is good to get it now. I'm scheduled to get mine at 1:30 today, so I recommend you do get that. There are predictions that we will see a bigger flu season this year than last year, but that's a prediction. We'll wait and see. The flu vaccine gives you 60% protection, whereas the COVID vaccines have been giving us 80 and 95% protection, which even though it's 60% lower, it's definitely worth getting. And if you are older or immune suppressed, you can get severely ill with the flu, and it would be definitely in your favor to get the flu vaccine to prevent a severe illness. Remember, you still might get a mild illness from the flu, but typically it protects you from the severe illnesses similar to the COVID vaccine. So I hope that answers the question.
I think it did. And to follow up on that, Dr. Green, I know a lot of us who got the first 2 shots, regardless of Moderna or Pfizer, had somewhat of a reaction, had to stay in bed an extra day or maybe take a day off work. Are we expecting similar kind of reactions with the boosters in the 3rd dose?
Yes, great question. And the timing is perfect because a recent CDC article came out and said that the 3rd dose side effects are similar to the 2nd dose side effects if you got Moderna or Pfizer. And the main 3 symptoms are soreness in your arm and fatigue and a headache. So those are the top 3 symptoms. They did claim that the fatigue and headache were less with the 3rd dose, but the soreness in the arm was slightly more than the 2nd dose with the 3rd dose. So I hope I made sense there. The bottom line is whatever side effects you had with the 2nd dose, you may find a little similarities with the 3rd dose.
Okay, and I know that a lot of folks who have experienced COVID and was infected by COVID and also had the vaccine are wondering if the 3rd shot or the booster is still necessary because I already had the antibodies. Would you recommend somebody who has had COVID to go ahead and get that 3rd shot as well?
Yes, we recommend, as does the CDC, if you had been infected with COVID, we do know your immune system is revved up and you are highly unlikely to get infected in the next 90 days from that infection. However, it is the feeling of the experts that your immune system will drop faster after the infection than it will with a vaccine. So after 3 months, you would be susceptible again to get it. And if you got the vaccine, we think you would have a longer protection period that could go as long as 6 months, 9 months, or beyond. So yes, we are recommending to get the vaccine, even if you had the COVID. Now you will have a slightly more a side effect panel of fever, headache, sore arm, but they're mild, and it's because your immune system is revving up, and your immune system is what's really giving you those symptoms. But it's definitely worth your while to get the vaccine. When should you get it after the COVID illness? You should get it within 10 days or more afterwards, because we don't want you contagious when people are around you trying to give you a vaccine. If you waited a little longer, that's okay, but I wouldn't wait too much longer. The sooner the better, but no sooner than 10 days at least.
Okay, thank you for sharing that. And like you said, there's a lot of information out there about the vaccines. And I wanted to bring David into this conversation. From the patient or survivor perspective, I wondered if you had any tips or resources that you could recommend to someone who may be looking for more information on vaccines. Do you have any insight on that, David?
Well, I certainly use the common, public domain sources like CDC. But in my case, I'm sort of in the Venn diagram. I'm both immunosuppressed, having gone through a couple of stem cell transplants, and my 6-month anniversary of my second Pfizer shot had come up almost at the same time. As I was consulting with my hematologist, I go in regularly for updates to make sure my multiple myeloma hasn't come back. So it was really his recommendation, Steve, that I used as my guiding light to make that decision. And it was a very easy decision for me to make, quite frankly.
Well, I'm glad you're doing well, David, and glad to hear you're able to use those resources. So it sounds like that you did your own research and made sure you had credible sources was the key in making sure you made the right decisions there.
Yes.
Now, back to some of the questions we're getting on Facebook, and we're getting a lot of them coming through now. Dee Dee says or asks, do I get a third shot 28 days after the second, or do I wait 6 months? According to her pharmacy recommended waiting only 28 days. So I guess she's wondering which direction she should go with that. So maybe Dr. Green or Dr. Keenan, you could clarify that.
So I would say that if you are considered immunosuppressed, and that definition includes cancer patients, especially with leukemias, lymphomas, myelomas, bone marrow transplant, solid organ transplant, heart, kidney, etc. If you have a solid tumor, you're not as immune suppressed, but you still could easily fit into that category. If you don't have cancer and you're not considered immune suppressed, then that makes all the difference. So you really need to consult with your doctor. Are you immune suppressed if you're not sure? And if you are immune suppressed, then you should get the vaccine 28 days after the second dose. If your doctor says you're not immune suppressed and you don't qualify, then you should wait the 6 months. But again, you have to qualify for the categories that Dr. Keenan outlined. Are you a first responder, healthcare worker? Are you having those age groups that have the other illnesses? It gets very complex. That's why you need the help of your doctor to sort out, do you qualify for the immune suppressed category? Do you qualify to get the vaccine because you have other illnesses that don't make you immune suppressed, and your doctor recommends you get the third dose, and then that'll sort it out. So it's very confusing, I'm sorry, but that's the best explanation I can mention. Bob, any clarifying points that you might throw in?
I don't know if it's going to clarify, but I'll just add that from our research, as well as from research from other areas, it's important to understand the purpose of that third shot, whether it's for the immunosuppressed or whether it's a booster. The purpose in the first category, those severely immunosuppressed, is because we now know that there's populations, as Dr. Green had mentioned earlier, that just don't mount a response after 2. You can look at their blood and they don't have any antibodies, or they have very, very low antibodies, or the antibodies they have aren't the kind of antibodies that are actually going to fight infection. So in that group, the third dose is really critical to be able to mount that response. And we're seeing that, and other researchers have seen it as well. On the other hand, if you are more normally immunocompetent, if you're like most people, then it's really all about the antibodies waning over time. And there we do know that delaying things actually can help in the ability to actually mount a more vigorous response when you wait. So it's really all about, do you need that shot as adequate protection from the start, or are you really just trying to boost things at a later date?
And to follow up on that, Dr. Keenan, this ties into a question from our viewer, Linda, and I have this question too. Does Moffitt test for antibodies after someone who is immunocompromised receives the vaccine? And as a second question, kind of a follow-up to that, I've heard, and Linda has as well, that if you have a reaction to the vaccine, that means you have the antibodies. I wondered if you could address those.
So let me answer the second question first and say, Linda, to be honest with you, I really hope that's not necessarily true, that the degree of reaction indicates that you've had a better response, because I had no reaction. But I really hope that I do have a response. And when you talk to immunologists about that, it is true that you can kind of make a reasonable assumption that your reaction to it will generate that immune response, but it's not a given. And so we do know that there's a range of responses that people have in terms of their side effects, but that really doesn't correlate with how good or how poor the ability is for you to generate those antibodies. Going back to your first question, commercially, there are not a lot of tests out there that commercially will answer the kind of question that the viewer is asking for, because what you're really looking for is those neutralizing antibodies. So it's not just having antibodies, but are they actually antibodies that are effective against the infection? And then how many of those antibodies? So it's not just are they there or not, but quantitative, how many are they? And most of the commercial tests, and the ones that we have here, will not give us that kind of detailed quantitative information. So it'll say, do you have some antibodies? Yes, no, but it won't necessarily tell you how much of an antibody response, and it won't tell you whether they're neutralizing or not. Now, there's some lab work and there's some specialized centers that are doing that, but most commercial places are not.
And to kind of follow up on that, Dr. Keenan, when someone does go to get this booster shot or the third shot, is there a doctor's note required to kind of show what those underlying issues are? How does that part work?
No, we trust you, right? And so the piece of information that we really want is to have some documentation of the type of vaccine you got originally. Because one of the things that I may not have mentioned right at the start was that this authorization for this booster shot for those people who are not severely immunocompromised. So the people who are getting boosters, it's only for people who got Pfizer originally. So if you got Moderna originally or J&J originally, at this point, there's not an authorization for a booster shot. Now, when that occurs and when the FDA and CDC signs off, then we will offer the Moderna. We've never offered really the J&J, but we will offer the Moderna as a booster shot, but we're not able to do that now. And so basically what we ask for when someone is signing up for a booster shot is to have proof that you had the Pfizer vaccine and give us a date when you had your second dose so that we know it's at least 6 months.
Okay. And I know that we've talked a lot about how immunocompromised patients, are more eligible for this, et cetera, and also how cancer treatment itself can make you immunocompromised because chemotherapy specifically can be rough on the body. So Tony has a really good question. He says, as a 63-year-old Moffitt patient not under active chemotherapy, can I get the Moderna booster now? Would he be eligible?
So, Tony, unfortunately, right now, the answer is no, because you got the Moderna originally. And so when we get the authorization from the FDA and the CDC to give a booster, then we will be able to offer you that booster. If you had originally received Pfizer, you would now be eligible, because we basically consider all of our cancer patients, whether they're on active treatment or not, fulfilling that underlying medical condition, which would make them eligible for as long as you're 18 and above. So your specific situation with Moderna, unfortunately, no. But if there's anyone out there who is not under active treatment, and they got Pfizer, then by all means, as long as you're 6 months out from your second dose, we're happy to offer you the booster.
Now, I know we're talking a lot about, the third dose and of course the booster shots, but Vicky has an interesting question, and I think Dr. Green, you may be the one to answer this for us. How soon after having COVID can you get the first vaccine if you've not been vaccinated yet? Is there a waiting period there?
Well, again, we would prefer that you wait a minimum of 10 days from the onset of your symptoms or the positive COVID test, and then you would be deemed no longer contagious. And therefore, you could come in and get the vaccine if all your symptoms are resolved as early as 10 days from that beginning point. And then if it's any time after that, you can start your vaccine series at any time.
Okay. And is there any specific type of cancer that would prevent somebody from getting the vaccine? And the reason I ask that is Rebecca asked if the vaccine is recommended for someone with brain cancer. So to expand upon that, brain cancer, any other kind of cancer, is there any cancer that would make a physician say you don't need to do the vaccine right now?
So I would say the answer is no, in the instance that certain immunosuppressed cancer patients should not get live vaccines because it could spread all over their body and cause illness. And those live vaccines include the shingles vaccine and the measles, mumps, rubella vaccine. So those are considered live vaccines. The flu vaccine and the COVID, all the COVID vaccines are not live vaccines. Now, the J&J vaccine is tied to a virus called adenovirus, but it has been attenuated in the lab to be not dangerous to people. So the messenger RNA vaccines such as Moderna and Pfizer are not live viruses, and you could get it no matter how immune suppressed you were. The only downside is if you are extremely immune suppressed and we gave you the vaccine, you would not mount an immune response because your immune system is so suppressed. And that's where your doctor comes in on the correct timing. So if you had a drug like Rituxan or some other chemotherapy drug, your doctor might wait weeks to months before they give you a vaccine because they know that anything they do during those weeks and months will not even mount an immune response. It's just going to be a waste of getting the vaccine, but it's not going to hurt you. It's just not going to give you the protection you want.
I see. And David, I think you would have an interesting perspective here. I was curious. I mean, you talked a little bit about getting your vaccine and the third shot. Did you have any reservations either before you made your decision to do that third shot or actually getting the third shot? Did you have any concerns or worries? Because there's a lot of information out there.
So Steve, I'll answer only from my own journey.
Mm-hmm.
When Moffitt made it available to me, I didn't really hesitate. I have put my life in Moffitt's hands and in the doctors and nurses who have cared for me. So when they made the recommendation, it wasn't a moment's hesitation.
Okay. And thank you on behalf of Moffitt for saying that. I know that means a lot to the folks on this meeting. Let's see, we have a lot of questions still coming in, and this is a good one too. We've talked about the booster and the third shot again, of course, as we've been talking about, and we keep reading about the Delta variant that's out there. The booster and or third shot is effective against the Delta as the original COVID. Am I correct in that? Will it be just as effective to protect us from the Delta?
Yeah, so the Delta variant is more contagious, so that the original variant in the beginning would potentially spread contagious-wise to 2 people. The Delta variant, which is more contagious, it potentially would spread to an average of 5 to 6 people. And then because of its more contagious, and it tends to break through with people that have low immune or antibody response. And because of that, that's why we're trying to rev up the immune system, because it requires a higher antibody level to prevent it. The good news is plenty of data is out there that all of these 3 vaccines available will give you excellent protection against the Delta variant. Even if it's slightly not as good as it was against the original variant, it will still do its job, which is to prevent you from dying and from being admitted to the hospital or getting put on a ventilator. Now, remember, no vaccine is 100%. So you can easily know someone who got the vaccine, did everything right, and either died from it or did get in the hospital. But the probability is much in your favor that it will not happen to you, but it's not 100%. So we definitely recommend it. And it does cover the Delta variant. And then when you read about all these other variants that are around, none of them at this moment are replacing the Delta variant, which is making up over 99% of all viruses in the United States. So if you read about Mu and all these other Greek alphabet kind of variants, none of them at right now is concerning that it's not going to be covered by the current vaccines. Will it happen in the future? Probably, but as of now, there's not one out there that we're really concerned about, but we're definitely realizing in time it will likely happen, but it hasn't happened yet in a large scale.
Okay, thank you, Dr. Green. And just to clarify, the Moderna booster or third shot is not available yet, but the Pfizer one is. Am I correct there? Am I remembering correctly?
Well, this is where we need to make sure it's a tough distinction, but it's an important one. Mm-hmm. When we talk about a third dose, we're really talking about that dose for those immunocompromised patients. That's been authorized now for almost a couple of months now. And that is for either Pfizer or Moderna. The booster, which is really just a recommendation, if you want to take it, for those people who are more immunocompromised, the booster is just for Pfizer right now. But if you're immunocompromised and the strong recommendation is for a third dose, it's either Pfizer or Moderna.
And I will add on to what Bob said, is that at Moffitt, we strictly follow FDA CDC. There have been instances where you go to a pharmacy, you show them your card and say, I want a third dose of Moderna, and they give it to you, even though you didn't fit into the classic criteria that Dr. Keenan said. But other pharmacies who do follow the strict, guidelines like Moffitt will say, no, you don't qualify. We're not going to give it to you. So I'm not recommending you shop around and find some pharmacy you get it, but I'm just telling you, you may have friends, family say, well, I got my third dose, and it's because we're going to follow the guidelines, and a lot of other pharmacies and centers will. But there are others that aren't as strict on those criteria, and there are people have had the Moderna third dose that didn't follow the guidelines. So I just want to throw that out there to clear the area on that.
And that's a very good point, because like you said, we all have heard of people who have gotten the third shot or the booster, depending on how they refer to it. Which brings me to a question that Christine has. Do you have to make an appointment to get the booster or the third shot at Moffitt? And where is it physically done here on campus?
Yeah, good question. So yes, it is by appointment. We are offering those vaccinations at both the Magnolia campus in the SRB, in the Stabile Research Building, and over on the McKinley campus as well. So we're offering that 5 days a week at both of those sites. You do need to sign up, and hopefully there's been a lot of communication sent out or will be sent out by email. It's on our website as well. I'll give you a phone number, which is area code 813-745. Let me make sure I got this right, 745-8000. So 813-745-8000 is the phone number you can call. We would also offer that if you're at all concerned about whether you should get it or not, connect with your provider, connect with your physician and clinic. You can send them a message through the patient portal or give them a call if you're at all concerned. But the phone number is 813-745-8000, and you can get an appointment.
And just to clarify, Bob, that is only for Moffitt patients?
So right now, it is the message is going out to Moffitt patients. If you're a family member of someone who works at Moffitt, there was a separate communication go out as to how to sign up directly through a scheduling algorithm. But if you did receive, I mean, basically anyone who received a vaccine, previous vaccine, the Pfizer vaccine at Moffitt, you can go ahead and call that number. If you're a patient and you previously received your Pfizer vaccine somewhere else, you can still sign up for that booster dose, and we'll give it to you at Moffitt. But again, we want to make sure that we're giving you the correct vaccine, so we'll want to make sure that you bring your proof of vaccination so that we can confirm that it's Pfizer.
Now, to follow up on that, Dr. Keenan, and maybe Dr. Green, you can elaborate on this as well. Are there any precautions that cancer patients should take after the booster or the third shot? Because I know that whenever COVID first came out, we wanted to make sure that cancer patients were taking extra steps to protect themselves. Are those protocols still in place for the third shot or for the booster? Any suggestions or advice for cancer patients?
Yeah, so I would say that even if the immune system is boosted up to the maximum it can 2 weeks after your third dose, you still should continue to avoid crowds, wear your mask when you cannot socially distance, wash your hands, and don't change your behavior pattern because you still could be in that 5 or 15% of people who, despite all that vaccination coverage, could still be susceptible to a severe illness. So if you keep all those other measures going long-term, that will prevent you to not only get COVID, but also to prevent you to get the flu and the other viruses circulating. So don't let down your guard with those others at this point. Now, I know that the CDC temporarily said, if you're vaccinated, you could become freer and do more things. And I understand the logic behind that, but then they retracted it and found out that, right now the hospitals are full of patients and have been with 90% are unvaccinated, but 10% with severe illnesses were vaccinated. So again, it's not 100% coverage. So do the other measures to keep yourself from getting infected.
And if you're just joining us, remember our experts are answering your questions about the COVID-19 vaccine and boosters for cancer patients. So please continue to post those in the comments section below. And to follow up what Dr. Green was saying, David, I wondered if you could add a little bit more perspective from a patient point of view. When you did decide to get that shot, were there any specific recommendations that your provider shared with you that you would like to share with other patients?
No, I think, well, yes. And I think they were very similar to what Dr. Green offered, which was just stay a little more vigilant in terms of our precautionary measures. So I live at home with 2 unvaccinated children. They're both under the age of 12. So we're careful for them. And I have a 92-year-old mother who I'm a caregiver for. So on the other end of the spectrum, I've been vigilant for that purpose as well. So I've just continued my behavior. Truthfully, we put our guard down a little bit early summer. And then when the Delta variant started to change the environment, we put our guard back up, and it's remaining up ever since.
And understandable. I think we're all like one foot out the door, then we bring it back in because we want to be as safe as possible. This is a question from Tony, and again, I'm not sure if Dr. Green or Dr. Keenan, if this goes to you, but it's about antibodies again. Is there any way to learn how many antibodies have developed after getting the booster? Is there like a blood test? Is there something? How do you know what your antibody count is?
Since Bob answered that last time, let me elaborate on his prior answer in this question, which is that right now the CDC it does not recommend you get an antibody check to see if your immune system worked or not. Now, under the guise of research, which we're doing here at Moffitt and others are, that's where we get the information of, will there be an official recommendation in the future that we check your antibody level at some point after this vaccine, which we almost never do with any other vaccine. So the bottom line is that your doctor could order the antibody test, and hopefully they know which one is being ordered, because there's different kinds. And as Dr. Keenan said, does that mean I'm protected or not? And so the important point is it killing the virus, which again, your doctor would know the right test to order, number one. And number two, does the test actually give you a quantitative number, so that the higher the number, the better, and they can give you a very informed answer to that question. And when would it even be measured if you were going to measure it? Well, you would measure it at least 2 weeks after the vaccine to any times afterwards. And again, you would do this in a study pattern so that you can tell how long does it stay up high and when does it drop to now need another dose, or now you're susceptible. So again, outside of a research setting, we don't recommend it. And if your test is negative, then there's a good chance the vaccine did not help your immune system to prevent infection. But not to get too confusing, there's two components to your immune response. One is the antibody, one is another memory cell that can reactivate later on, even when your antibody test is undetectable. So you may still have an immune response even when your antibody test is undetectable 0. So it gets complicated. That's why your doctor could help you figure out what is your immune system probability of being up there, and whether you need an antibody test and what it means.
Yes, it sounds like it's very individualized, and everybody has a different reaction and a different need. And this kind of ties into our question from Blanche. She shares that she had a stem cell transplant in 2009 with a side effect of LGL. Do you recommend that she get a booster shot in that instance?
Yes. So if she's already had the 2 vaccines, she should get a third. And right now, the stem cell doctors, bone marrow transplant and other transplant doctors, they're actually drawing up guidelines that if you got a stem cell transplant, you now inherited the person who gave you the stem cells, if it wasn't yourself. And therefore, at some future point, you may have to redo all your vaccinations again. So that's a very special, unique situation where you're getting someone else's immunity and they have completely annihilated your own immune cells. Those are when you get from other people. Then it gets complicated. At what point should you get the vaccine series all over? And those discussions and recommendations are now happening here at Moffitt and other cancer centers to give you the best advice on that. So that's what I would recommend for those who got stem cell transplant. Your doctor will know when you're ready for that.
And Dr. Keenan, this question goes to you, and this one's from me. I know that our protocols and the ways that we handle the COVID-19 and the vaccines and now this third dose and booster are constantly evolving. I wondered if you could tell us a little bit about what that process is like, and how does Moffitt gauge and decide what is the next step in order to combat this pandemic? Can you give us a little bit of insight on how that part works and why we keep changing things up a little bit?
Sure. Yeah, for many of us, it seemed like one of those bad roller coaster rides. And I'll bring Shani into this. It's probably something that Disney would never do, is create a COVID thrill ride. But the problem is severalfold. One is that it's, for us, it's a new virus. And so we're still learning what this virus is all about and what it can or cannot do. It has evolved, as Dr. Green has said, from the original virus that affected us back a year and a half ago to where we are now. And there's other variants around the world. It has to do with those other variants and do they rise to a level of concern or not. And fortunately, this new variant and the previous Lambda variants do not seem to be doing that, but Delta obviously rampaged through the world and through the US. So all of those factors come into play. And so then what we do is we put in restrictions based on the conditions at the time, and then we monitor for how those conditions are changing. So one of the things that we're looking for instance, is in the community, in the Tampa Bay region, in Florida as a state, what are the number of new cases that are occurring each week? And we look at a rolling average, and we look at how many cases per 100,000 population are occurring each week. And as we see those numbers decline, then we start thinking, are we able to open up the enterprise a little bit? And as those numbers rise, we need to shut down. And so if we just take this most recent Delta variant, back in June, which seems like eons ago, but back in June, we were at a very low level. And as everybody knows, we were relaxing the visitor policy. We were relaxing our meeting policy. We were relaxing our masking policy, and the freedom that people felt that they could engage in community and social activities. Well, then all of a sudden Delta comes through, and we go from having a case rate of around eight new cases per 100,000 on a rolling average. And all of a sudden it shot up, and the peak was like 115 cases per 100,000. Well, you got to respond to that. We were seeing our hospitals overwhelmed with COVID patients and taking up large numbers of regular hospital beds and ICU beds. Fortunately, Moffitt wasn't nearly as affected as our general community hospital partners. And I think that's a tribute, going back to David's comments about what cancer patients do. I think that's a tribute to the fact that cancer patients are very sensitive and are very, very reasonable in terms of the precautions that they take. So we have to look at things like the changing case rate. We have to look at not just what's happening in our region, but more broadly across the state, because we have patients coming from across the state. We also have to look at our staffing. Because our staff gets involved, and there could come times when our staff are affected, and we have to adjust operations that way. So all of those things go into consideration when we're making those changes. And as Dr. Green said earlier, it's even hard. The CDC, which you look to for a lot of guidance, flipped on a dime with regard to the masking issue, just because circumstances change so quickly. Our hope is that this fourth surge, if you will lead to a period where we have a little bit more stability. And so hopefully we won't have to roller coaster like this, but you never know. And ultimately, at the end of the day, it all comes down to immunity in the community, natural immunity, more healthfully vaccinations, high levels of vaccinations, so that the virus just doesn't have a place to land.
Yeah, absolutely. And thank you for explaining that, because it is very complicated. It is constantly changing. And as you said, it's a COVID coaster that we've been on for the past year and a half, and it's a thrill ride nobody wants to be a part of. Shani, I wanted to bring you in to kind of piggyback on what Dr. Keenan was saying. From your perspective with the Patients Advisory Council, I guess, what is your perspective from over there on what patients are learning and seeing from Moffitt? Are we communicating correctly? Do they seem to understand where we are, and do they know what to do?
There's a lot of information out there, and there's a lot of misinformation out there too. And so when I have the opportunity to engage with Moffitt patients, usually, sort of like in the waiting areas, and you hear patients talking about, there's like, well, I'm not sure if I should get it or not. This information says that it's just a trial and you shouldn't be sort of like trying it. And my answer to everyone is, speak to your Moffitt specialist. Let them help you make the right decision, rather than you making the wrong decision based upon your health criteria.
Mm.
And in answer to Dr. Keenan's statement about Disney would never ever do a COVID coaster, many years ago at Epcot, we had a program, a simulator called Body Wars, which actually looked at the effect on white blood cells when a splinter entered the body. So never say never, Dr. Keenan.
I remember that experience, actually.
Yeah, it was fun.
I can't believe that, the hour has already flown by. So, but before we wrap up, I want to see if anybody has any parting thoughts or anything else they wanted to add before we said goodbye for the day. And any other thoughts before we say goodbye?
I would just say, sorry, David, to interrupt you, but I would just say that if you could get vaccinated, definitely it's in your best interest. And if you have family members, try to encourage them to get vaccinated because they give a wall of protection around our cancer patients. So the more people around you that are protected, the more safe you can be. And then they think in November, they might start offering the vaccine to children. And right now, 1/3 of parents said they would get the vaccine, but I would encourage, even for your kids, even if they have a low risk of infection, the side effects of the vaccine are 100-fold less than the actual virus itself. So I also encourage when the kids are allowed to be vaccinated, please consider that too. And that will also help everybody else and you to stay safe from infection. So that's my last parting words.
Thank you, Dr. Green. And David, was there something you wanted to add?
I just, we've all seen the courage billboards all over town. So I would just suggest to my fellow patients that we act courageously and decisively. So get the information as quickly as you can, make your decision. And I've always trusted Moffitt, so I continue to do so. And hopefully everyone else will feel the same way.
Well, thank you, David. And thank you so much to each and every one of our panelists for answering these questions today. And also thank you to everyone in the audience for joining us and submitting those questions for us. For more information on the COVID-19 vaccine, you can visit moffitt.org/COVID. And Shani, would you like to share any closing thoughts on behalf of Moffitt's Patient and Family Advisory Council before we leave?
Just like to thank everyone for joining us today and hope that this information has been worthwhile of your time. I know it certainly has for me. I never cease to be amazed by the eye-opening information that Dr. Green and Dr. Keenan share when we have these sessions. And again, I encourage patients that are joining us today and non-patients also to partner with your cancer specialists to ensure that you're getting the right information and making the best decision for you and for your family members.
Thank you, Shani. And thank you, everybody, for joining us. Please have a wonderful day and continue to remain safe. We'll see you soon.
Thank you so much.